There we go. So welcome everyone to another episode of our branch out sessions. Today we'll be talking about breaking the vicious cycle of chronic pain. For those of you who don't know me, my name is John Sorrell. I'm a clinical psychologist and the director of clinical content at Upside Health. I've worked with Upside Health for over 3 years, I think closer to 3.5 years. And we've been doing these branch out sessions for a while now, and excited to be able to share more knowledge and information with you today, and hopefully will be useful for you as you're navigating your journey with chronic pain. Just to give you an overview, all of the sessions I've been doing, probably the last 6 or 7 months, have involved talking about, at least briefly touching on the 4 systems of responding. It's relevant in every topic that we'll ever present. And for those of you who have seen it, it'll be a review. For those of you who have not, it'll be very important to gain that foundational understanding of what these systems are and how they fit into your experience with chronic pain. Then we'll get into which vicious cycle are we going to actually focus on. As you probably know, there are many cycles that may occur within the context of pain, and figuring out which one to focus your time and energy on will be of critical importance. Next, we'll break first and then break, and talk a little bit about what that means and how it's relevant. Go through a few important steps in breaking the cycle that you've selected to put your time and energy and efforts towards. And then finish with an example and some questions that are important for you to have answered, if I haven't already addressed them during the formal presentation. So, reviewing the 4 systems of responding. The 4 include our physical, emotional, our cognitive, and our behavioral systems. Probably the most popular, or the one that comes to mind most readily in the context of pain, is our physical experience. Beyond the physical experience of pain, it also includes other biological processes. Breathing, for example, muscle tension, our heart rate, blood pressure, neurotransmitters in our brain, blood flow and circulation, different hormones, essentially anything physiological or biological that's happening inside the body. This is what we refer to in our physical system. Our emotional system is, as the title would suggest, it's our emotions: fear, anxiety, depression, happiness, joy, gratitude, just the full spectrum of emotions. Our cognitive systems includes our thoughts, our expectations, what we believe to be true. An example is catastrophizing is a type of thinking process. Often it occurs in the context of chronic pain and has just huge importance and influence on our experience. Another topic that I've talked about in previous sessions includes mindset, is essentially the framework from which you're looking through your mind's lens, or the way that you look at the world, and how that impacts and influences various experiences. And then the 4th system is our behavioral system. Categorically, avoidance and escape are foundational in the context of things that are uncomfortable. We tend to avoid them, or we get away from them if we contact them, and this includes pain. Other behavioral processes might be your procrastination, hesitance, whether or not you engage, approach certain situations. Now, really important is to know that there is a dynamic interaction among all of these systems. They don't occur in a vacuum or in silos. They influence one another. So what you see in these 2 slides is there's a bidirectional connection with the arrows and all of these systems. And that's just to illustrate how our behavioral process will impact what happens to us physically. So for example, if you get closer and closer to let's say a campfire, you will begin to feel the heat of that campfire the closer you get. So your behavior is starting to impact where you are in your environment and how that impacts you physically. Having experiences behaviorally will also impact you emotionally. Of course, as you evaluate and think about what has happened, this will help to establish your beliefs and your cognitions or your thoughts around those experiences. So just important to know that there's a dynamic interaction, and that will happen across all of our different experiences. So moving into the vicious cycles of pain and trying to figure out which one are we going to focus on. Each of you, as you're listening to this presentation, you may have one or two that kind of are at the forefront of your awareness. If you're not quite sure, maybe there's many different cycles that you're aware of and you're just not sure which one to put your time and energy towards. Asking a few questions can be helpful. First is, where is the most impact from a particular cycle happening in your life? Sorry, I thought I heard someone asking a question. Not sure what that was. So asking, where is the most impact in your life? In particular, where's the most disruption? It might be with regard to your sleep. It might be regard to some particular behavioral process. For example, your posture, the way that you move your body when sitting and then to standing position, or how you may do a certain activity. And you may notice that there are cycles, there are triggers that are activating this cycle. And so it's causing disruption in the way that you live your life. There may be another question that's important to answer, which is, how much does this cycle distress you emotionally? It may have some impact on your life, but you found ways to minimize that, but it's still really distressing for you emotionally. So this would be an important question to answer as you identify which cycle you're going to focus on. A few other questions to ask is, which cycle change will make the biggest impact? The one that bothers you the most might not actually have as much of a wide casting net in terms of changing that cycle having the most benefit across many different areas of your life. So that could be an important question for you to identify, which is going to have the biggest impact on the broadest spectrum of your functioning or your emotional well-being. Another question might be, there are so many different cycles, there's so much impact that I just don't even know where to begin. I feel so overwhelmed just thinking about it, let alone trying to picture one of these being something that I can focus on. So trying then to answer the question of which is the lowest hanging fruit, maybe the easiest, simplest one that's right there, that requires the least amount of energy, effort, and planning, but that's going to have some change that's going to result from intervening in the cycle. What this does then emotionally and behaviorally is it creates momentum. As you make change, it will set the stage for future change. So sometimes focusing on the easiest, most accessible cycle to begin modifying or making change towards can really have a positive influence as you're moving forward. So thinking about these 4 questions can really help as you identify which cycle you're going to focus on. I say break first and then break the cycle. And I have this saying, I don't know where I came up with it, it's been years, where I say a necessary prerequisite of intentional behavior change is conscious awareness. And this is just a fancy way of saying that if you're going to make something happen in your life on purpose, you've got to really be aware of all the different things that influence that. So before you can even make change, one, like what we did before was we asked some questions. So we're actually pumping the brakes to help us figure out where is it that we need to focus our time and energy. This is helping to create conscious awareness, whereas we might just react very often to pain or any other uncomfortable aversive stimulus. And that reaction might cause change, but it's not necessarily something you're doing on purpose or with intention. You then might wonder, well, why is it that some days things feel good for me and other days they don't. Well, you might be unconsciously making change with this reactive process that your body's sort of triggering when you're feeling a certain um, stimulus or comfort level or discomfort level. But when you're more aware and you're conscious of all the different variables, you can now do this systematically and maybe have a better understanding of what you're doing that's working, what you're doing that may not be working quite as much. And now you can um, review, kind of make assessments about where those changes in breaking the cycle will be most beneficial. So pumping the brakes first is super important, and then um, applying your strategy to break the cycle, which I'll get into in a moment. I wanted to also mention the stages of change model. This is a model that's pulled from often behavior change in the context of addiction and recovery. And the folks who came up with this, essentially, we have 5 different stages. First is pre-contemplation. Essentially what it means is that you're not even aware of the fact that there might be a problem. Others might even say to you, are you conscious of the fact that you do X, Y, or Z? And you may not have yet pumped your brakes and increased your conscious awareness that there's an issue that needs to be changed. All of you are past that. You're aware of the fact that there's a problem. You have pain. But contemplation is now the next stage where you're wondering, okay, what do I need to do? I'm pretty sure I have a problem. It seems like it's having a pretty big impact on my life, but I'm not exactly sure how I need to do things, what I need to do. So you're in this process of formulating motivation and awareness of the fact that there's something that needs to be done. Preparation is you've come to that place of decision that there is in fact a problem. Now I'm gathering information, I'm gathering resources, I'm gathering the things that I'm going to need in preparation to make change. That includes a branch out session, that includes books and going online and reviewing different materials, asking questions, talking to your doctor, getting all of the necessary equipment, if it's literally concrete things that you need to bring into your plan, or if it's just information, whatever it might be, you're gathering all of those things. Action is implementing. It's putting into action all of that preparation that you have gathered, information, skills, materials, and equipment, whatever it might have been that you prepared. And then maintenance is going back and reflecting, is looking at how does the action that you just put into practice, how is it working for you? What's the impact on your pain? What's the impact on your mood? What's the impact on your thought processes? And ultimately your behavior, your action, your engagement in life. So these 5 stages just gives you, I think, a good framework sometimes to think about, how am I going to break my cycle? Which cycle is it going to be? What do I need to prepare in anticipation of taking action? And then what do I need to make change as I'm maintaining the action plan that I've implemented? So 3 steps. Trying to make this easy. When I was putting these slides together, I had 7 steps, and I thought we don't need 7, we need fewer. So we have 3 steps in breaking this cycle. We have already talked about the first one, awareness. Monitoring your force systems. I think this is really important, and I just want to touch on it a little bit more. I mentioned in the beginning, physical, our emotional, our cognitive, and our behavioral systems. Monitoring them, what does that mean? Does it mean thinking about how does pain or the cycle that we're looking at impact these systems? Yes, to an extent, but it can't stop there. So often I'll ask people, well, how does it impact you? And they'll be able to say a few things, but when you're really looking to change a vicious cycle and break that cycle, you have to be a master of understanding of all of these systems and every single thing that you can possibly be aware of that influences that cycle. So if you think about, what did you have for breakfast today? You can probably tell me. What did you have for breakfast yesterday? You could probably tell me that too. I don't know about you all, but as I get further and further away from today, my memory is not as good as it used to be. And so I forget. Now, with something as simple or as seemingly as irrelevant as breakfast, think about the complexity of pain and all of the different variables that go into maintaining a cycle that is vicious, that is disruptive, that is physically and emotionally painful. If you can remember every single thing that might be part of these four systems of your experience, I need whatever it is that you had for breakfast, because that is going to be something that I want to be able to teach people and pass along. But it's unlikely that that's going to be the case for anyone, or at least not most people. So writing it down, using a recorder and talking into the voice recorder, or even taking pictures of things so that you can remember and go back and look at and monitor what are the variables that are part of this cycle and experience. Now we move into the preparation of a plan. We want to bring in skills across all four of these systems. So what's something that you can do that will impact your physical system? Well, I've talked in the past about diaphragmatic and focused breathing. And I've got into great detail about how breath is fundamentally critical and so important in changing our physiology. I won't go into too much depth about it right now, but your breathing is instrumental in creating wider heart rate variability, which is an indication of general cardiac health. But it also is a way to help bring tone to the vagus nerve, which is a nerve that is connected to many different physiological processes in the body. It's also connected to our parasympathetic nervous system, which you may remember from previous branch out sessions. The two branches of our autonomic system is our parasympathetic and our sympathetic. Sympathetic is our stress response, parasympathetic is our relaxation response. The more that you can do things like breathing in a controlled and systematic way that helps to bring heart rate down and activates our parasympathetic system, the more you're taking away from what activates our pain response and the various systems that feed into our pain response and its intensity. So breathing is a very simple but incredibly effective way to reduce activation in our physical system. Breathing can also be a behavior. So you can bring that behavior into your coping and your preparation for a plan as a way to impact your physical system. Impacting the thought system is identifying your expectations and your negative thoughts that feed into your emotions, anxiety, fear, or, for example, I mentioned catastrophizing, expecting the absolute worst outcome of a situation related to pain in which you have absolutely no control. That's more or less the definition of pain catastrophizing. So if you have those types of thoughts, we want to understand, where does that thought process have basis in evidence? What can you point to that says that's absolutely true? And if there's evidence that suggests it's not entirely true, how can we find a more balanced way of thinking about that experience? And then with regard to skills in emotions, you may have heard me talk about surfing the wave of emotion, riding it out. Emotion-focused coping versus solution-focused coping. Solution-focused coping is focusing on the problem and working on a solution. If there's not, and you can't control the situation or change that problem in the moment, you have to manage your emotion around it. Breathing is a good way to do it. Progressive muscle relaxation is another way to bring down muscle tension, but it can also reduce anxiety and stress. As you prepare your plan, SMART goals: specific, measurable, action-oriented, realistic, or rewarding, and then time-based. Short-term and long-term goals will help you break your cycle as you're applying your skills in preparation for implementing your plan. And then answering the questions who, what, where, when, and how. All of this is going to be details that make your plans specific and measurable. You want to put things into behavioral terms as much as possible so that you know when you're doing them and when things are working or not working. And this will help you see your progress. And then last is putting that plan into action. And then as you're seeing it unfold, what's working and what isn't, making adjustments as needed. This is an example that I put together that essentially, I'll just walk you through it briefly. We have our road and we're guided by our life compass. Here's our true north. And this road is our path towards, in this example, it's towards a productive life, living and consistently with my career. Part of that might be going to work. There are many different aspects of what defines your connectedness to your career or productivity. But just for this example, the path is moving towards productive life related to my career, going to work. Now, something happens, I have an injury, and this pain, it triggers a bunch of thoughts. I can't do this anymore. It hurts too much. My emotions include fear and anxiety, anger, eventually start becoming depressed, whole host of physical sensations, rapid heartbeat, my breathing is shallow, my muscles are tense, might even feel nauseous. So I avoid anything that triggers these thoughts, emotions, physical sensations, including the pain. When I do that, but look where I'm going, my behavior takes me towards this emotional detour. And this is a very vicious cycle. When my behavior is focused on avoiding activities that hurt, it puts me into the cul-de-sac of this detour where I'm spinning round and round, not towards life connecting me to what's important to me. In this case, it's my career. So we have to break this cycle using the various things that I've suggested earlier in previous slides. I'm not going to go through each and every one of those just in the interest of time, but want to take one last moment to say it's so important for us to take our shots. We miss 100% of the ones that we don't take. You're guaranteed not to disrupt the vicious cycle of pain if you sit back and you just wonder what it would be like if you took action to do something. You've got to take the shot, even if you miss. Now you have information to help make adjustments so that the next time you take a shot, you'll be less likely to miss. So I just want you to encourage everyone, even if you haven't made a thorough plan, it's worth taking your shot to get the feedback of information that you might get from taking that action. So with that, I want to thank you for your attention, questions, comments, thoughts. I'll leave up here on the screen just the information about our next week's branch out session. And with that, I will open it up. So let me just close, sorry, the stop recording. All right.